Hi everyone, I am Dr. Dev, Director of the Blood Center. Welcome to Blood Donation 101. Today, let me introduce to you the composition of blood. Blood is red-colored body fluid. It is composed of red blood cells, platelets, plasma, white blood cells, and other proteins. Blood plays a vital role in human health. Now, let me guide you through an introduction to the blood component family and explain how blood components work.
Hi, I am a red blood cell. My siblings and I make up the majority of your blood. Do you see? This is what we look like together as red blood cells. We are red in color and very small. Under a microscope, we look flat and round. We have a biconcave shape which looks like a donut with a thinner, indented center. Our main job is to supply oxygen to the tissues and cells throughout the body and remove some of the carbon dioxide produced.
We are the brave and invincible white blood cells. We are larger in size than the red blood cells, and we possess defense and immune functions to protect your body from infection. We are the shape-shifting warriors of the blood.
We are the smallest cells in the blood. Even though we platelets are small, we are of great use. We play a vital role in clot formation to stop bleeding, helping with functions such as hemostasis, wound healing, inflammatory response, thrombosis, and more.
Our blood family circulates to every part of the body. Through the cardiovascular system, we connect the entire body to deliver essentials like oxygen and sustain the interconnection between various organ tissues. Blood transfusion plays an extremely important role for reviving critically ill patients and those being treated for certain diseases. So, where does transfused blood come from? The answer is from voluntary blood donors. There are two types of blood donation: whole blood donation and apheresis donation. With apheresis donation, the donated blood components can be red blood cells, platelets, or plasma. Single donor platelets, SDPs, collected through apheresis are a common type of platelet donation. At a critical moment, a transfusion of platelets can save a patient's life. Next episode, the role of platelets. Donate blood, save a life. "10 minutes ago, there was a traffic accident at Beach Road. The driver had severe injuries, resulting in massive bleeding. Rescue is underway at the National University Hospital. The patient is in urgent need of a platelet transfusion. Platelets play a vital role in clot formation to stop bleeding. When a blood vessel bleeds due to injury, the body sends out a signal for help. The platelets receive a signal that immediately activates them and rushes them quickly to the wound. After some complex changes, the platelets form a platelet plug to temporarily block the wound, achieving initial hemostasis. When additional platelets are transfused, they help with clot formation, and a solid blood clot forms to block the wound and stop the bleeding. A patient at a cancer center has experienced a sharp decrease in the number of platelets due to chemotherapy, which has threatened the patient's life. The attending physician suggests an immediate platelet transfusion. In clinical practice, various diseases can cause a decrease in platelets, and there is a clear correlation with a low number of platelets and high risk of bleeding. Through prophylactic platelet transfusions, the risk of spontaneous bleeding can be greatly reduced, lowering the mortality rate. Platelets are vital to many patients, and they are the most precious gift. Only by transfusing them can life be prolonged. The tiny act of blood donation by donors is a lofty tribute to the lives of others. Perhaps you do not realize it, but every act of blood donation is composing a magnificent chapter on saving lives. Life continues because of the altruism of blood donors and blossoms because of their kindness. The warmth from vein to vein connects the unending hope together. With the advancement of blood separation technology, and especially apheresis collection, transfusing blood components has become possible. In particular, platelet transfusion has become an important part of component blood transfusion. How can you donate individual blood components? Stay tuned for the next episode hosted by Dr. Dev. Next episode, Blood Donation Q&A with Dr. Dev. Donate blood. Save a life. What is apheresis donation? Dr. Dev will answer your questions one by one. Question 1. What is apheresis donation? Both apheresis donation and whole blood donation are voluntary blood donations by healthy people without compensation. Apheresis donation is an automated process where a specially designed blood collection device draws blood from the donor a little at a time. The desired blood product, which can be platelets, plasma, or red blood cells, or a combination, are separated from the rest of the blood using a centrifuge inside the device. The remaining components are returned to the donor. The withdrawal, separation, and the return of blood are a continuous process during the procedure. This is the main difference between whole blood donation and apheresis donation. Question 2. What are the donor requirements for an apheresis platelet donation? Basic requirements for apheresis donation. Each country's blood donation guidelines include requirements for donors such as age, body weight, blood pressure, pulse rate, and other factors. These guidelines mandate a blood test before donation to confirm the health of the donor and the absence of blood-borne diseases. There are other requirements, like minimum interval between donations and maximum number of donations in a year. Please consult your local blood center for details. Question 3. What is the process of apheresis platelet donation? There might be some slight differences in your local blood center, but the basic principles are similar. 1. Complete the registration form. Answer questions to confirm your eligibility for blood donation. 2. Physical examination. Have a quick physical examination with a doctor. 3. Blood testing. A few blood samples are taken for preliminary screening. 4. Donate blood on apheresis system. Once you have been qualified, you can proceed for apheresis donation on the blood collection system, such as Terumo cell automated blood collection system. You can choose to donate either a single or a double unit of platelets, depending on certain criteria. Most platelet donations on Terumo access take approximately 40 to 60 minutes at high efficiency. Specially trained staff will be there throughout the procedure to take care of you and closely monitor the collection. During the entire process of donation, you can watch movies, listen to music, read newspapers or magazines, or just relax. After the blood donation is finished, the nurse will remove the needle from your arm. All you need to do is apply pressure to the needle site and rest for 10 to 15 minutes. You are then free to go as long as you feel well. 1 unit of apheresis platelets can save the life of a patient who is on the brink of death due to serious bleeding. A therapeutic dose of platelets from a single donor is equivalent to the platelet content in 5 to 7 units of whole blood. With regular apheresis donations, you can help ensure a stable supply of blood components for patients when they need it, with a greater impact and a greater sense of achievement. Voluntary blood donation, connecting veins, saving lives, warming the world. Next episode, Blood Donation Press Conference 1. Donate blood, save a life. If you have questions or concerns about apheresis donation, feel free to raise them here. I will answer them for you.
I heard that apheresis donation will lower the donor's immunity. Will apheresis donation cause harm to our health?
No. Regular apheresis donation will not lower the donor's immune system or physical fitness. The average generation cycle of platelets is 2 to 3 days, with an average lifespan of 7 days. As compared to red blood cells, platelets generate and renew more quickly. For healthy individuals, the donated platelets can recover to pre-donation levels within 48 hours, which is much shorter than the 4 to 8 weeks of recovery time for RBCs after donating whole blood. Regulations vary by country. Please consult your local blood center to determine the required minimum interval for donating platelets. The recovery rate after blood component donation is faster than that after whole blood donation.
I heard that people might gain weight after donating blood. Is this true?
No. Weight gain in the human body usually occurs due to an imbalance between food intake and calories burned. With our current standard of living, dietary structure and nutritional status, there is absolutely no need to follow a special diet or eat more than usual after donating blood. That may result in an intake of excess calories, resulting in other side effects that are not good for our health.
Infectious diseases are horrible. Can donating Apheresis platelets spread infectious diseases?
No. Currently, the needles, tubing, and disposable sets used worldwide for Apheresis donation, as well as the LRS compartments and other consumables, are strictly sterilized, single-use disposable that are fully sealed. They are not reused. Throughout the Apheresis donation procedure, the donor's blood moves only through single-use, closed-system plastic tubing and disposable sets. The donor has no contact with any other person's blood. Strictly sterilized, single-use disposable are used to transfuse blood to the patient, and the donated blood components are thoroughly tested for safety. Next episode, Blood Donation Press Conference 2. Donate blood, save a life. Most countries in the world have been advocating for voluntary blood donation. However, many people are unfamiliar with Apheresis donation. Today, we continue to uncover the truth about Apheresis donation.
Which blood component is donated during Apheresis donation?
Apheresis donation is an important source for platelets globally. Most Asian donors can donate either single or double units of platelets, depending on certain criteria. To ensure the health of the donor and the quality of the platelets, each donor's platelet count is tested before donation, to ensure their post-donation platelet count is not lower than the normal platelet level in humans. The generation and destruction of platelets in a healthy human body maintains a dynamic balance. When platelets in the body decrease significantly in the short term, it stimulates the hematopoietic function of the bone marrow to produce more platelets to reach a new dynamic balance. This is why there is a strict guideline of a 2-week interval between blood component donations.
Will anemia occur after donating blood components?
Not at all. Apheresis platelet donation targets only platelets from the peripheral blood, while plasma, red blood cells, and other cells are returned to the body. Therefore, Apheresis donation does not cause anemia. In addition, donors are carefully screened, and people with anemia will not pass the health screening.
Will Apheresis donation cause unstable blood pressure?
No, it won't. Normal blood donation will not cause pathological hypertension or hypertension. Donors with unstable blood pressure are not qualified for donating blood. Before each blood donation, the staff measures the blood pressure of the donor. Only those with normal blood pressure can donate blood. Occasionally, individual donors may experience slightly high or low blood pressure during the donation process. It is often due to nervousness. If this happens, just rest and keep calm, and your blood pressure will return to normal. Donate blood, save a life.